All right, this is actually a pretty serious. This isn't a video to congratulate you. This is not a video to tell you, well done, you finally got the diagnosis. Because the reality is that you've known that something has been happening over the past several months, or even worse, the past several years, and now we just got the diagnosis of migraine. This video is to serve as the reality of the upcoming challenges that you will face. This is not to put in fear. This is not to put in any false expectations. This is simply to give you the reality of what I see every single day for people who suffer from migraine. Number one, you are officially on what is called the medical merry-go-round. What this means is that you just went to your neurologist and you left and they diagnosed you with migraine. It might be ocular migraine, it might be hemiplegic migraine, it might be vestibular migraines. Welcome to the medical merry-go-round. Number two, be your own advocate. Everything that a doctor tells you, including myself, everything that a doctor tells you, please seek clarification on it. I see far too often patients who have suffered from migraines for 10 years, 15 years, sometimes even as far as 20 years or 25 years, depending on when they come into the clinic. I see far too often that they have just listened or obeyed out of trust, right? Because people go to school for this, but they just obey every single thing that their neurologist tells them, or that their ENT tells them, or that their family practice tells them, or that their holistic medicine doctor tells them. And the reality is, if you do not understand something, seek clarification. This is very, very important because you will get prescribed medications. Realistically, they will probably start with a high-grade Tylenol, and then that will then translate into other things. It'll go from Tylenol to a higher dosage, and then those will not work. And then it's going to go into Amitrex, and then that's not going to work. And then it's going to go into Topamax or the generic topiramate, and that is not going to work. Then it's going to go to Amivig, and then it's going to go to Nurtec, and then it's going to go to nerve blocks, and then it's going to go to all these things that we think are going to help, and they are not. Which leads me to my third point. Get ready to spend a lot of money. You have great insurance. Yes, your insurance says that they'll cover the Amivig injections. Yes, your insurance says that we'll cover the MRIs after you see so many visits at the doctor. The MRIs will come back inconclusive. All the testing will come back inconclusive. The medications are just putting a Band-Aid on the actual problem. Listen to me. Take a deep breath. You will be okay, but you need to be prepared to spend a lot of money on this diagnosis if you do not catch it early. And if we do not do proactive things right now to get you off of that hamster wheel. The reality is this doesn't just start overnight, right? You think of all these different diagnoses that people get. Yes, you got diagnosed today or yesterday or last week, but the reality is that it was a process to even get to that point. First you woke up and the head felt kind of weird, and then you took a hot shower, then it went away. And then you woke up and you didn't feel the best, so you took a hot shower, that didn't work, so then you just took an ibuprofen and then it went away. It started somewhere. It did not start at the point of diagnosis. Unfortunately, most doctors start treating at the point of diagnosis versus gathering a holistic history of all of the different things that you have been through, physically, emotionally, and any chemical stress that you've placed on your body over time that have been causing these migraines to essentially surface into what it is today at the diagnosis point. This video is not to harm you. This video is not to scare you. This video is not to, obviously not to congratulate you. This video is for clarification because migraines are a debilitating, disastrous disease. Migraines suck. And I'm not the type to use that kind of language, but migraines suck. Let me give you a little story. I'm into this work because of my wife. My wife used to suffer from migraines. The day that it all came together for me, my wife and I, we had just bought brand new Trek bikes, and we were so excited to go ride them on this day, and it was an absolutely beautiful day. And her and I were ready to go out and conquer the world the day before this trip took place. And then what happened is this. The next day came and a migraine hit her like a freight train. Now, she suffered from migraines her entire life. She sought chiropractic care, she's been to the doctors and all these different things, thinking that it would help her migraines, and it didn't. At this point of time, I was actually learning traditional chiropractic, and even those were not helping my wife. I was learning this very particular technique called knee, chest, upper cervical technique. It's a technique that I practice today. And I was looking at all of the literature around it to try to see, is this actually effective for migraine? I remember that day when it came to that biking incident that I was so frustrated with my wife that I was like, me as the caregiver, I'm like, I really want to go on this trip, but now you have to lay in bed in the dark. This is terrible. Like, I want to go. And I'm being very vulnerable on video, telling you I messed up as her husband by being that ignorant to how much migraines impact people, let alone the person who I devoted my entire life with, my beautiful wife. So when I started learning this work, I told her, I was like, I know you suffer from migraines, all the research points towards it. Let me go ahead and take you through an examination and get you your first adjustment. And I did it, my friend. And when I adjusted her and I saw that light turn on in her eyes, I threw out everything. And I knew that God was calling me to do this work that I do for the rest of my life. And that's exactly why I do it. Now I have a much better understanding on the neurology and all these different things that help influence the system. And this is not the case for everyone where one adjustment just knocks out migraines forever. I want to make sure that that's very clear. But the reality is that migraines stem from a central nervous system issue. Migraines are what's called an idiopathic condition. Idiopathic just means we have no idea where it comes from. Idiopathic means that there's no known cause for what causes this, but when you look at the literature shows us that it seems to stem from something within the central nervous system. So it makes sense that migraines are clearly an indication. They're not a diagnosis, really. They're an indication that something's happening inside of the central nervous system. So it would make sense to check the central nervous system. It would make sense to be able to look at everything from a holistic approach to try to see what physical stress, chemical stress, or emotional stress has been going on in this person's life over X amount of years that has led to the system being stressed out, cause it to overload itself, and end up causing these migraines. And that's the reality. So my friend, if you got diagnosed with migraines, just know that this road that you're about to go on, if you choose not to get off it, this road you're about to go on is going to be long. Just know that this road you're going to go on is going to be daunting. Just know that this road you're about to go on is going to require a lot of money, a lot of out-of-pocket expenses, despite the fact that your insurance covers some stuff. Just know it's going to be a while, but also know that health is in your hands and that you can ask the right questions, understand what medications doctors are giving you, make sure that your doctors are communicating with each other, and make sure that your doctor is taking a holistic approach in understanding you in your particular migraine case, so that way they don't lump you with every other migraine patient that they've taken care of.